بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. Good evening everyone. I hope you got benefit from last week session, and for this reason I'll start by just a recap of the last session, but this recap will be from you. So who can start and tell us what we covered last week, and what is the main benefit from this session before we will go through today's session, inshallah. So the mic is yours, and feel free also to write on the chat your reflection. This is like a reflection which will be covered today, inshallah. Okay, who will start?
I'm Dr. Saira. Assalamu alaikum. Last week, we talked about various kinds of assessments that should be done at various levels of knowledge gains.
Okay.
So that's one thing. And we, of course, talked about workplace based assessments and about situations and what assessment to be done in what kind of situation.
Okay. As you know, we like in FAMR the what is called the aha moment or the learning moment. So, what was the most important learning moment in last week session?
Most important learning moment. There were so many important moments. I can't pick out one moment.
The one that you said, oh yeah, I am happy to hear about this today.
Okay.
Anyone can answer, no problem, Dr. Asira, no problem. Anyone can answer this, and I hope that there were more than one learning moment, as you mentioned, inshallah. Hopefully this, or something that you will, inshallah, apply in your practical or in your clinical teaching. Because what we hope from both sessions, inshallah, that you have something that that is applicable in your setting, or you can also train your colleague to use it in clinical. Okay, I think we have something in the chat. To know different types of assessment. Thank you, Dr. Abir. But till now, it is general. We need something to be more specific.
It was for me. It was aligning the assessment tools with the levels of the know-how, do, show, and so on. Because I was confused in some levels.
Okay.
So
Good.
aligning the assessment with these levels was very useful for me.
Okay, good. And which aspect of the utility formula this will be reflected on? You remember the utility formula that include maybe 6 items, which is the validity, reliability, impact, feasibility, cost effectiveness. So what you mentioned, Dr. Abir, is aligned with which element of this utility formula? That you select the most appropriate assessment tools for the appropriate level.
I guess it is the validity.
Yes, shukran, Doctora. Thank you, Dr. Abir. Yes, the validity. And also we mentioned that to ensure the validity, we need what? Validity equal what? Equal blueprint. To ensure that your exam or assessment is valid, you must have a blueprint. And last week when we were speaking about workplace-based assessment, we mentioned that we have 2 types of the blueprint for workplace-based assessment, the micro one and the macro one. Okay. It seems that we didn't have a lot. Yes, sure. I hope for it. Okay. I think someone wants to participate or share her reflection, or it is just an echo. It seems that it is just echo. Okay, no problem.
Okay, I would like to share that I
Yes,
was
Dr.
impressed.
Noor, how are you?
Yeah, thank you. I was impressed by the Miller Pyramid. The fifth
Mhm.
one is which reflect the identity. I can
Okay.
also, yeah, it was a aha moment that identity is very important, where it's not only about how to do things and when, it's also how you are doing it with your identity. The
Mhm.
other thing that I think it was an aha moment, the tools, when you spoke about the checklist that might be not time consuming, but also reflective. And you also think we all discussed the challenge of being subjective because it would differ from one supervisor to another. I think that's the
Okay,
point that,
mashallah. Wallahi, thank you, Dr. Noon. These are very important aha moment. Yes, I agree with you about identity or the S level. And also, I agree with you about the two important point about it is not a checklist rather than it is a rating scale, both the traditional one and the O score, and about subjectivity and objectivity, and how to make as much as possible the workplace-based assessment objective using those skills, especially the O skills. Okay, thank you all for sharing your reflection and aha moment. To have a portfolio, good, mashallah. To have a portfolio, Dr. Abir, inshallah, we will, يعني, hopefully, بإذن الله, we will cover some aspect of the portfolio. Yes, we to document the workplace-based assessment. Thank you that you remind us that if we start from the start that we have workplace-based assessment start by good observation, then giving feedback to the student, and the student must write her or his reflection, and all of this must be documented in a well-formulated document, especially portfolio, as you mentioned, and based on this, a decision about student competency will be taken by the committee or whatever its name to judge if the student will proceed to another level or he or she needs a remediation or even to repeat the rotation, for example. Okay. In workplace-based assessment last week, we covered the mini clinical exam, mini CX, and the DOPS, which is the direct observation of procedure skills. And we left only one of the most important, which is case-based discussion. If you remember that when we were speaking about case-based discussion, it is about a challenging case that the student will be confronted with a case in the form of the notes of the case, and he or she will study it or to investigate this case, and after full exploration to the case, it will start a discussion with his or her tutor about the most challenging aspect of this case, which is called the case-based discussion. So case-based discussion is one type of workplace-based assessment, which also for learning. Most of them are mainly for formative, but also can be used for summative. And in case-based discussion, it is like an in-depth interview between a trainee and a senior trainer or the assessor, and based on medical record. To start the discussion, start by exploring the knowledge of the trainee, judgment, clinical reasoning, and management in challenging cases. Why these cases was referred to cardiology or to nephrology or whatever, and cover of a range of clinical problems relevant to the stage of training specialty. The focus mainly on record keeping, clinical assessment, management, and professionalism. And the main aim is to provide a feedback to help the trainee improve their clinical judgment, clinical reasoning, and decision making, and encourage them for reflective approach to learning. What are the competencies that covered by CBD? Medical record keeping, clinical assessment, management and follow-up, professionalism, diagnostic skills, clinical judgment, communication, reflective practice, and leadership. How to start? The trainee will select the medical notes, but must be one of the challenging, complex, difficult case that showed many reference or one of the complicated cases, for example, that Renee does most of the talking, taking to the assessor, take the assessor through the case from the start, like telling his the story of this case from admission till leave the hospital or till the moment of the case-based discussion session. Assessor follow up with supplementary questions. And most important in case-based discussion is the questioning skills, because you need to have this skills to ask both open and closed questions, and use the keys of WH, which is when, where, what, and how to ask the student about, and why to ask the student about the case. And by the end, both the trainee and the trainer make judgment about the management of the case, followed as usual by feedback, reflection, and uploading the document on the portfolio, whatever it is, online, or keeping it on student record. The case-based discussion is longer than other types of assessment, the mini clinical exam or the DOPS. It takes about 30 minutes of discussion. Okay, let's go directly to the case. And I leave, and you already have, inshallah, you will have all the presentation to read it, but just to go through the case video like every time. And after the case, you need to evaluate the student based on this rating scales that cover medical record keeping, clinical assessment, investigation and referral, treatment, follow-up and future planning, professionalism, and overall clinical judgment. And also, as usual, anything especially good and suggestion for development. And also remember that in all rating scales, you need to include the level of the student, because it will differ in your evaluation. And if this is the first time or the second time to be confronted with case-based discussion, so this is that of Norsini, that it is in the, I think, the AMI guide number 31. And I'll share it with you, inshallah, by the end of today. So let's go to the video like last week. And this time we will, inshallah, use the OSCORE. If you remember it, which differ from the traditional one, it starts from requires a complete guidance, which is I had to do, then able to perform but requires the repeated direction. I had to talk them through some independence but intermittent prompting required. I had to direct them from time to time. Independent for most things but require assistance for nuance. I had to be there just in case. The last and the highest level is complete independence. And as you mentioned last week, it is about trustability, that I didn't need to be there with the trainee. Okay, let's go to the scenario. And after it, as usual, you will, inshallah, evaluate the student using this rating scale, the O score. Bismillah.
Okay, thanks for coming up and making the time to meet with me today. I've managed to look at the 3 cases that you've put together. I'm particularly interested today for you to discuss the pleuritic chest pain case.
Yeah, actually, she was quite interesting. This one here, I think, this is a 26-year-old lady who I saw a couple of weeks ago, who actually presented to ED with pleuritic chest pain. She was pregnant, and she told me at the time that she's had this pain now for about 2 hours prior to when I saw her. And she said that she was quite short of breath with it. Now, I had a look at her, and besides having a mild tachycardia, there was really nothing else to find in the examination.
Okay. What were you thinking about this patient's presenting problem?
I think due to her age and the fact that she's pregnant, my 2 main things were a PE. Clots are always dangerous. And also infection. So based on my examination, the things I was looking for were signs of a DVT, some leg pain or leg swelling, also signs of infection, either with fever or she's had a recent cold or flu.
Okay. Dan, just looking at your notes, there are some important clinical features on history that you've documented. Can you take me through them?
Yeah, sure. So thinking about a PE, like as I mentioned at the start, there was my major differentials were embolus or a clot or infection. Just embellishing the clot perspective, I was asking about the PERC criteria, see if I could PERC her, although it was quite difficult with her. Asking about any prior history of a clot or a PE or a DVT in the past. I was actually just reading through here. I forgot to mention the fact that she'd actually just flown back from England. She's just come back on holiday, I think, to be with her family because she's pregnant. So that's obviously something I should have put down. That is quite important in the history. Other than that, I thought I actually got the major points there. So please direct me if I need to pop something else there.
No, I think you've covered all the significant features that I've recorded, and I'm glad that you did highlight that point. I think it's an important point, of course, in terms of period of mobilisation, particularly for this case.
Okay, good.
I was particularly interested in these investigations. Why did you order these?
Well, I didn't get the VQ scan because the way things go, I wasn't going to be available for a little while. So those are the ones that I actually got, just because I was concerned about PE.
Okay. And what aspects of this patient's care did you find challenging?
I think in any young person, the issue of radiation, and especially that's double with a fetus, when she's pregnant. So I was trying to be careful about ordering a CT scan or a CTPA for a pregnant girl.
Okay. I noticed though that you didn't order a D-dimer. Can you elaborate a little bit about what utility that test has in a pregnant patient when you wish to diagnose, exclude a PE?
Sure. I mean, as you know, the D-dimer is a love-hate relationship with doctors. The D-dimer is not very specific with a pregnant woman.
What do you think went well this time, and for next time, what needs improvement?
I think on the whole, the case went pretty good. I was happy with what I found, but a little bit more potentially about the lab investigations would be helpful to talk about.
Well, what aspects of the case do you feel you need to brush up on so that next time when you see this case or a similar case again, you can manage it better?
Look, I always find a challenge with pregnant women and the choice of investigation. It's usually clear to find rules about when to order certain things, but this girl, she wasn't too sure on her dates as to exactly how far through pregnancy she was. I knew she was pregnant, but whether she was nearing the end of her first trimester or into her second trimester, I wasn't too sure. So learning points for me, or revision points, is to find out exactly when the best time to use a VQ over a CT, or vice versa. So yeah.
Yeah, look, I think that's a very important point in managing pulmonary embolism or potential pulmonary embolism in a pregnant patient. And I'll make a note of that on your form. Thanks, Dan.
No worries. Thanks.
Okay. So this is the case-based discussion. After this, we need to evaluate this trainee about his performance. Okay. As usual, we will go to menti.com, either writing this code, which is 129068836, or just scanning this QR code and go direct to menti.com to start the evaluation.
دكتور معلش ممكن الكود again؟
حاضر دكتورتي، ثانية واحدة. هو هيظهر قدامنا دلوقتي تاني، بس جاست انا برضه هعمل له كوبي احطه في الشات. Okay, it is now on the chat, doctor. And you just need to go to menti.com. Okay. Okay, so the first part of this checklist is medical record keeping. And as we agree, we will inshallah use this O score, which start from I had to do, then I didn't need to be there. And this is if you need the explanation of each item is for each item. I had to do what it means. I had to talk them through. I had to prompt them from time to time. I needed to be in the room just in case I didn't need to be there. Okay, this is the time to evaluate. Doctora, and here is the code here. 129068836.
Thanks, doctor.
Okay. So what about medical record keeping? Okay, alhamdulillah, we just start. I need to be available just in case. Okay, I agree, and if I will evaluate with you, I'll give him the same. Okay, we have only two, and also you can write on the chat, by the way, no problem. Oh, mashallah, 8. I didn't need to be there. I had to direct them from one time to time. I need to be available just in case. Okay, and from the third to the fifth level. Okay, but now I think that the most of you agree that I need to be available just in case. Okay, good. And we have, mashallah, 12 answered, and it seems that the majority about I need to be available just in case, alhamdulillah. So it is, I think it is a reliable assessment, which is called inter-rater reliability. Okay, what about clinical assessment? What is your evaluation for this trainee about his clinical assessment? Okay, I had to direct them from time to time, and I didn't need to be there, but till now I had to direct them from time to time. Okay, is increased. Okay, good. We have only 4. Oh, I need to be available just in case. And also I need to be available. Oh, I had to do. In clinical assessment, I had to do. Please, all right, I had to do. Why? I hope this is to be by mistake. Because I had to do it is the lowest level. I need to be available just in case. I had to direct them. Okay, so the majority also, I had to direct them from time to time, but the only which could be as a surprise that we have here, I had to do. يعني I had to direct them from time to time. Okay, I need to be available just in case. Okay, I didn't need to be there, which is the highest. Okay, but I had to do, which means that he didn't do anything. That means that the tutor or trainer not guide him. He didn't speak at all. This means I had to do. Okay, mashallah, we have 14 today, mashallah. Okay, good. So I hope and I think that I had to do maybe by mistake, not the accurate judgment. Investigation and referral. What about investigation and referral? I didn't need to be there. Okay. The highest and the first, the first bird was I didn't need to be there. I didn't need to be there. The majority till now. I need to be available just in case. Okay. So there is يعني a competition between both. Oh, mashallah, we have 10, team 5 and 5. Okay. I had to direct them from time to time. Okay. Okay, but still, I need to be available just in case is the majority, which is good also. We need one more to be 14 like last time, because we are now 13. Who will add? We missed someone from last time. But by the way, we are 38. يعني less than the half are participating with us. Right, okay, good. Next. Next is related to follow-up and future plan. I'd like you to notice the progress of the evaluation. Start by keeping a medical record, clinical assessment, investigation, and here we have we have the investigation, yes, and the referral. Before it, we have, and I missed one, clinical assessment, and the first one was medical record. Okay, so it like gradual, going step by step in the process of clinical assessment, or what we can do with any case. So in follow-up and the future plan, we have I had to direct them from time to time. Okay, which is in the mid. This is the third level. Who else? I need to be available just in case. Okay, we have now the majority. I had to direct them from time to time. Okay, mashallah. We have 10, but the majority is between I had to direct them from time to time. I need to be available just in case I had to talk them through. Okay. Which I think also the majority is in I had to direct them from time to time, which I think makes sense. Because follow up on the future plan may need support from the trainer and will be improved with feedback and reflection. MashaAllah, we become 15, but the majority also I had to direct them from time to time. Okay, thank you. The last, I think, is the last professionalism. What about professionalism? I need to be available just in case. Okay. Oh, mashallah, we have 5. All of them I need to. Okay, I had to direct them from time to time. Okay. The majority about in okay, we have also I didn't need to be there. The majority I need to be available just in case, which is the 4th level. Okay, good. So I think till now, alhamdulillah, we have a consensus between us in our evaluation. I had to direct them from time to time. Okay. Okay. Now we have what is called overall clinical judgment, which is like the control item that whatever he or she performed, but we need a question or one item for overall evaluation. And on the quality metrics, we make like a correlation between the judgment here and the judgment in other items. I need to be available just in case. Sometimes if we have a red flag for this trainee, sometimes he pass in all other items, but this items will fail him or her. So this is one of the most important item in checklist. Also in OSCE, and I think you have something like this in the OSCE used for the level of how. Okay, I need to be available just in case. I had to direct them from time to time. Okay. Okay, so the majority here, and I need to be available just in case. Let's go to the feedback. Anything especially good, you need to write here. Anything? Nothing? History taking, willing to learn and discuss freely. Confidence. Okay, he was thorough with his assignment, but a little push needs. جميل. Okay, systematic. Confidence. Average communication skills. We will come to the anything. I think average communication in the area that need to be improved. Okay, I'll take this and I'll tell you why I'll take this. Copy. Okay. Professionalism, average communication skills. Okay. The last but not least is about suggestion for development. There is any suggestion for development? And by the way, this feedback will be written and will be kept with the student to read it, and based on it, he or she can write her or his reflection. Will learn if supervised well, work more on communication skills, more training, more communication, more practice. Okay, sorry, I'll take this. More communication skills. Okay, Control C. Good. Thank you. We just finished now the last tools of workplace-based assessment, which is case-based. We have something here. Oh, mashallah. I'm sorry that I didn't see it. I need to. Oh, sorry. This. Oh, wallah, I'm sorry that I didn't read all this. But let's read from. Okay. Dr. Salwa, professionalism, attitude, communication, and body language was casual. Good. MashaAllah. Thank you. And I'm sorry, wallah, I didn't notice the chat. What we will do now before we go to the today's session, which is about feedback and reflection, I promised you that we go through the AI, especially our meme friend ChatGPT. ChatGPT or any tools of AI can help us in write professional feedback for our students. Let's try this. I just and I put this prompt. I just finished a case-based discussion with my trainee on a case, for example, not necessarily a need of chest pain. I noticed that he needs to work more in communication skills. Can you help me to give him about a constructive feedback? Feedback about this issue and how he can improve his communication with patients and help care team. So through any tools of AI, and this is an introduction to the next session, inshallah. So this is, I can give the AI tools a summary of the performance of my student and ask it to write a feedback like this. So it mentioned, start with the positive. You did a good job today in analyzing the case of chest pain, and I appreciate how you logically went through the different diagnoses. Your clinical knowledge is solid, etc. Highlight the communication gap. Give specific actionable recommendation with patient, with healthcare team, and with encouragement and commitment. Then would you like me to also prepare a short written feedback note you can share with him? Yes. So
Can
this
I
is the
add something? Sorry, can I add something, please?
Yes, والله I'll tell you والله دكتور to participate, but اتفضل دكتور. Yes,
No,
sure.
I'm sorry to interrupt you. If you, I can wait till you finish this idea. Okay.
Sorry.
Would you like me to talk now, or I wait so you can finish this idea?
Yes, you can talk, no problem. اتفضل. Yes, you
Thank
can.
you. Just from my experience with proof editing or rewriting or refining our feedback, what I noticed, it would help a lot when we add the context. That
Yes.
what is my level, what is the trainee level, what's the time plan. I want to give action plan to the trainee, and I explain exactly what I need, because otherwise it will come like a generic feedback.
Yes.
It wouldn't be genuine, specifically personalized to the trainee. Thank you.
Thank you, Dr. Bassem. Fully agree with you. This is just an example, because in this session it is not يعني, directed to AI in a full direction, but is just an example for it. But let's go more depth, because mashallah you raised an important issue. I can start by this Dr. Bassem, which is more and more, inshallah. I think it will be of help also. Adding to what you just mentioned, you can even ask the ChatGPT to write the prompt by this way. As you write this prompt as an AI expert with 20 years experience as prompt engineer. Thank you, Dr. Bassem. Engineer, write a high quality prompt to help me to give a constructive feedback to my trainee on a case, on a base case, and on a case based discussion on chest pain to improve his communication skills. So what I did now, I asked the AI to write the prompt. Then I'll take this prompt and put it in a new chat box. And I think you will find the result, as mentioned by Dr. Basim, not a generic one, but more and more specific. Let's try this. And we have here in the chat. Okay, Dr. Wissam, this is just, it can be 10 years or 25 years, but it is just to tell the ChatGPT that you are expert in writing, in prompt writing or prompt engineering. So this will be the prompt. You are a medical educator and a clinical supervisor with expertise in assessment, feedback, and monitoring of medical trainee. You are also skilled in communication skills training and competency based. I need you to generate constructive professional feedback for a trainee who just participated in case-based discussions. The focus of feedback should be communication skills with patient and healthcare team, requirement of the feedback, etc. Here we can add what mentioned by Dr. Basim to put the context is the 5th-year medical student or trainee in a chest rotation in the residency program or whatever. Yes, Dr. Ghada.
Hi, Dr. Mohammed. I sometimes add if I have a checklist for case-based discussion or rubric or whatever the evaluation tools I used, I could upload this checklist for this specific trainee to the ChatGPT to construct a personalized feedback for this trainee only. In addition to the prompt you are performing, Dr. Mohammed.
والله ما شاء الله. It seems that we have ما شاء الله يعني more than one expert in AI, so it is not necessary to mention. It seems that it is not necessary to mention this because ما شاء الله we have
No, I found this is a better one for every feedback or whatever I give. If I have a personalized checklist or whatever I use in not only for case-based learning, for anything, I upload it, and he will take the point that he didn't fulfill and start to formulate a plan and feedback for everyone according to the missed part in the checklist or rubric. I actually benefit from it.
والله thank you دكتورة غادة and Dr. Basim, and this is one of the learning curve for all of us that we are يعني learning from each other. جزاك الله كل خير.
We know from you, Dr. Mohammed, you are professor. You are our professor. Yes. Thank you for your effort.
Okay, so I think this is one of the ways that we can use ChatGPT or AI, and even but mashallah, you know more than me. Sometimes, especially in case-based discussion, we didn't have enough cases to discuss with the student. So we can also give the ChatGPT or the AI tool the criteria of the case-based discussion and ask it to write a full case-based discussion for us, and you can depend on it. And I think most of you do this in case-based discussion in many CX. Even the rating scale, sometimes you need a rating scales or skills, as mentioned by Dr. Ghada, to be specific to the case of chest pain or abdominal pain or whatever. So it can tailor for us a specific mini clinical exam and a specific rating scales based on the case you want. For using AI, we can customize it and use it by the way that can facilitate our work in everything related to the AI. And sometimes we have like a special session for using AI in assessment, including the workplace-based assessment. But I think, mashallah, you didn't need more information about it, but because it seems that you are expert in using it in assessment, and today we can, and even if you need to score that inshallah we mentioned this in the reflection, score the student reflection, we can give, as mentioned by Dr. Ghada, upload the student reflection and upload the rubric and ask the AI to score the student based on the rubric or the rating scales and write the feedback. You just need to review the comment which comes from the AI and give it. And I think this will help you and save your time and effort And one of the most important issue in using AI in this way, it is about consistency and about reliability. Because sometimes, as you know, if we more than one person score the reflection, for example, it could be different. And even if the same person do this, you know, as happened with us in marking essay questions, sometimes you are tired or anxious or whatever or under stress, so this may affect your judgment or evaluation. But AI doesn't have any problem like this. Okay. Yes, والله يا دكتورة وسام, إن شاء الله we can arrange for this. Dr. Basim, make sure you don't share Trini. Thank you, Dr. Basim, for this. Yes, the privacy is important. إن شاء الله, we can ask AI to inquire about the details it want. Yes, thank you, Dr. Basim. We always okay. Make sure you okay. The tone. والله Dr. Basim, thank you. Yeah, the prompt engineering is one of the crucial point or crucial aspect of using AI. But now with our maturity with AI, we have more than strategies to write prompt like we did today. You ask the AI to write the prompt, and by the end of your prompt, tell it to use the anatomy of the high quality prompt. That includes the task, the rule, the context, the output, the condition. So when we add this to the prompt you write, it will cover everything you need. So and thank you for sharing your experience about writing prompt and even using AI in assessment. This is the AMI guide, which is the AMI guide number 31 for Norsini, and it is available free, and it includes everything related to workplace-based assessment from the start. All the checklists that we used last week and this week are in this guide. So alhamdulillah, we cover different types of assessment based on Miller, describe educational principle, the utility formula, key issues of implementation of workplace-based assessment, and I hope that the hands-on activity on mini clinical exam and DOPS and case-based discussion was of great benefit for all of you, including me. Today we will move, inshallah, to to completion of the workplace-based assessment, about the reflection, about the feedback, and the portfolio. Let's start by reflective practice. Reflection is like this. You sit at the river or in the sea beach and start to think about any experience, what happened good, what was bad in this experience, and what I learned from it, and what still I need to learn. So reflection is in the metacognition. It is the thinking process that allow to learn from our experience. It is like a self-assessment, and tell us where we want to go next. And this is the definition by Kenneth Wolf. The basics of it, you have an experience. After the experience, you need to reflect on it. Then you start an action for more and more learning. Or another concept, which is what, so what, and now what. And for each element of it, we have some details. And what, describing event or process. So what, thinking and analysis, and drawing a conclusion. Know what, it is the future goals and action. And I think, and you will agree with me, that reflection is mandatory for everyone. It is not only for learning, it is also for life experiences that we have in our life. But we need also a skills for reflection. The first and the most important one, it is about self-awareness. Without self-awareness, the person can't write his reflection. So because what you mean by self-awareness, that I know that I have something wrong in my work or in my learning, because some people usually or always I am right. I do everything good. I didn't have any mistake. So he or she didn't have a self-awareness. And this is what we want to teach our students and our sons and daughters about how to aware about his or herself. Then start by description, factual reporting, critical analysis, census evaluation. But from 2 to 6, it will be nothing if we didn't have a self-awareness. So the self-awareness is the main skills that is not usual in other academic writing. All of them, like description, factual reporting, critical analysis, census evaluation, is part of academic writing. But self-awareness is not part of it, and this is the most important skill that we need to be trained, and our trainee must have this skill to write a good reflection. So we have, as we mentioned here, we have more than model. The simple one, which is experience, reflection, action, and the protons Q questions, what, so what, and now what, with the details of each one. So we can use any model, especially the QB model, what, so what, and what next. And this is followed by a descriptive, who, what, where, when, the 4W, analytic, why, how, so, looking forward, where, what, now. There is another model, but it is more complicated with Gibbs model. Start by description, feeling, evaluation, analysis, conclusion, action plan. Whatever the model, but what we need to restrict ourselves to and our student to any certain model. I like this, the reflective journal, and we usually use it, and maybe Dr. Ghada with us in one of the courses that we taught it together, use it in one of the courses of communication skills, which is the reflective journal. Start by what has gone well and what has not gone well in the experience, in the learning process. Then the student or trainee need to answer, what have you learned from this experience? What will be done differently after this experience? The third but not the last but not least is, what do you see as your learning needs, the future or the planning for future? So this is the reflective journal, and we can use it with your student not only in workplace-based assessment, but at any types of assessment that you will give the student a feedback, and the student will reflect on her or his own learning, uses this reflective journal. And as you have this reflective journal, you must have a rubric to evaluate it. So what we will do now, that you will write your reflective journal on the last week session, and till this moment reflection. We need you to write what has gone well and what hasn't gone well. And by the way, when we are speaking here about what has gone well, it is mainly related to you. It is not related to the course. You can add what is related to course, but what is related to the course will be in the questionnaire or the survey that related to course. But we mean by the first questions that about you, about your feeling, or about your thinking about what has gone well for you in this learning experience and what has not gone well. And for the second and third question is the same. It is mainly related to you and your own experience with this course. It could be related to lecture, mini course, program, or whatever. And even it can be related to a life events that you have passed through it, and you start to think about it and write your reflection. Okay, let's go again to the Menti and start to write your reflection about the last week session by answering the 3 questions in the reflective journal. As it will be the same, Bismillah ar-Rahman ar-Rahim. It will be the same, but if you have any questions, please write it on the chat. Okay. What has gone well and what hasn't gone well for last week and till now on the session today? Most on well, but we need to learn use AI in this session. Okay. What else? Inshallah, يعني with Dr. Randa, we can arrange for a special session for using AI in assessment, not only in workplace-based assessment, inshallah. Learning new types of assessment techniques, but we need learn about AI techniques. Learning about different assessment methods. Okay. I know that we have a short time to write, but in reflection, we need to write in depth and in details. It is like a story that we can write it like this. In the first session, we started by navigating different types of assessment based on Miller pyramids. This is followed by the concept of workplace-based assessment. This was the first time to know about workplace-based assessment and its strategies. The instructor asked us about the tools that we are using in assessment, especially for the clinical and practical aspect of our teaching. The three types that were mentioned in the session were mini clinical exam and the DOPS case-based discussion. I like the use of both scales, the traditional one and the O-score. The S-score is much better because it like what happened in the real life workplace. It could be written like this. It's like a story that what happened. So we encourage the trainee to write their reflection every day, and by the end of each lecture or each session, not to wait to the end because they will forget. Okay, we have learning about different assessment, what good discussion, AI, so what I realized I need to know more, what the future good seeks the knowledge of AI. By the way, this is a good reflection, but we can move this area of AI to the last question. I learned a lot of new different assessment methods, but was a bit heavy to gather all this information into sessions. Thank you for this. Emphasis on the feedback as a learning opportunity rather than just a judgment good, the formative, and inshallah we will speak about feedback. I learned last week Miller pyramid, different level and different assessment strategy, which was enriching. Thank you. I get a good idea about the new assessment method. What has gone well? My knowledge in workplace based like this has improved well. I like the experience of the videos. What has not gone well? I wanted hands-on. This is good. That nobody mentioned what hasn't gone well. I know that you mentioned about AI, but it could be written like this. You answering the questions, but in more details. So I hope this give you an idea about this and how to be formulated well, either for us or for our students. So moving from what has gone well and what hasn't gone well to the next questions in the reflective journal. What have you learned from this experience and what will be done differently? Based on what you learned in this experience, what you will behave different from your current practice in assessment based on what you learned from last week's session. You got the idea of the second question? You already know about workplace-based assessment and about the scores and about the different Miller pyramids and about the how to evaluate. So what the changes that will happen in your practice based on what you learned last week? We have here on the chat, the presentation highlights the importance of Dr. Bess, the importance of assessment learner in real clinical environment rather than relying solely on written or simulated tests. Workplace-based assessment allows evaluation of practice skills, decision making, and teamwork in authentic setting. Good, thank you, Dr. Bess. Okay. ايه ده I need answer. I like that it seems that you write here more than last time, so you take some time, so no problem. I now appreciate workplace-based assessment as not just an evaluation tool but also a learning opportunity. MashaAllah, thank you. Feedback is central. Without timely constructive feedback, workplace-based assessment lose much of its value. Wallahi, MashaAllah, that you got this. And even we didn't go in depth in feedback, but because one of the items of the checklist or the rating scales was in the checklist is lead to feedback. Integrate AI on workplace-based assessment. Okay, mashallah. Yani we just touch AI, but I know that AI can facilitate our work not only in workplace-based assessment but in all sessions. And inshallah, I inshallah arrange with Dr. Aranda for this. What I will do differently in future, teaching. I will plan workplace-based assessment activities more intentionally, integrate them into regular clinical encounters and document. MashaAllah, thank you. To done different, to use this techniques in academic assessment. Good. But again, we need, I know that we have short time, but we need a thinking process, like a plan. What is your plan to implement workplace-based assessment in your setting? Assessor need training to ensure consistently fairness and meaningful learner support. I think we can move this to the next question, because in this part of the reflective journal, we ask about what you will do based on the training, based on your last week training and this week training. Okay, who else will participate, please? Who else? Okay. I have learned from the session. I would like to discuss and implement with my colleague. Good. So what you had learned, you will implement it. Thank you. I learned that every minute I spent with the trainee should be used properly for both teaching and assessment together, as continuous assessment is a big tool for improving the level of learner. Good, mashallah. Thank you. Good. Okay. Anyone is still writing? Okay. Let us go to the last but not least items. What do you see as your learning needs? We finished the what you has gone well, what didn't what hasn't gone well, and what did you learn it, and that what you will behave or make different in your practice. But what is still your needs for the future plan to make more benefit from workplace-based assessment sessions? Okay. Take your time, no problem. But try it. I would benefit from training in assessor calibration. Okay. To ensure fairness and reliability while working with colleagues. Okay, good. Training in assessor calibration. Good. ما شاء الله. And here, Dr. Iman, plan for assessor standardization. Good also. Inshallah. And we have also Dr. Salwa, learning G cycle, start from assessment to, it is G cycle, I don't know, it is G cycle, start of assessment to application. Okay. Please, if you read G, Dr. Salwa, mention what do you mean by G cycle, because I didn't know it. Okay. Only we have only two plan for the future as a learning needs. MashaAllah. There is no learning needs. MashaAllah, MashaAllah. طب one more or two more. My doctors. To expand, Dr. Best, to expand this into a formal personal development format with objective action and timelines with need. Okay, good, Dr. Basim. We need to expand. Okay, we need to expand this into a formal personal development plan. Okay, professional development which with objective. Good, mashallah. Hello, doctor. Assessment method to be known to all faculty for uniformly student assessment. Use easier methods and also have hands-on training on the newer method of AI. Okay, good. In this, I have just a comments, which is related to assessment method to be known to all faculty or uniformly student assessment. So usually the reflection is for me because what your needs, not the institution needs or the staff need. So be specific about my needs from after post session. For me, I need like this. For me, I need general framework and then discussing one topic at time till we complete it. This is the future. I need to read more. I like this. I need to read more about workplace-based assessment and elaborate on their application to higher level and translate theory into practice. This is very good. Performing more assessment and also reflect on my, mashallah, very good. Applying different workplace-based method. This could be in the last part of the reflective journal, the second part, which about what you can do different, because I think you know now about workplace-based assessment and the trend on it, so you can do this, but the future you need to include it here. I would like to have a simplified step-by-step guide to help us apply it straight away in our courses with ease. This can help us also speak to head of department and to convince them to apply it. This is good, but we can convert this to like an action plan that you will write a simplified step-by-step guide. So you can, could be like convert it to a learning needs. My needs is to write this like a guidelines or tips that can be of benefit to my colleague. I hope now, alhamdulillah, yani mashallah, you do a great job about writing your reflection about last week and this week, and this is what we need in the to teach our student and train them about reflection. Okay, reflection, like any reflection, could be considered like a performance assessment. Any performance assessment need, okay, good, mashallah, needs a tools, which like this is the reflective journal, or sorry, task, which is writing reflection, and a tool to evaluate it. The tool here we can use rubric. And as mentioned by Dr. Ghada, we can upload the reflection of our student and the rubric, then ask the student to ask the AI, upload it to the ChatGPT, for example, and ask ChatGPT to mark this reflection and give the student a feedback on it, a constructive feedback, and follow what mentioned by Dr. Bassem to write a good prompt to it. Whatever, ask it to write the prompt, then give the prompt to the ChatGPT to write to answer, whatever, but we need a good prompt to evaluate the student using this rubric. Let's go to the rubric. Rubric. Search. Okay. Dr. Salwa, can we have a little break for Salah? Okay, we can take 10 minutes for break for prayer, and we will add this 10 minutes to the end, so we can or 15 minutes even, and we can add this 15 minutes to the end, so can we inshallah finish 9:15? That is okay. Okay, Dr. Salwa. So let's go to the break for prayer and come back inshallah 8:32. Okay, no problem. So pray. And I'll take this time to search for the rubric for reflection. Okay. Okay, thank you all. Okay, see you after 15 minutes, inshallah. And inshallah, we will finish 9:15. Okay, thank you. Assalamu alaikum. Restart. Okay, this is the rubric for an example of the rubric for the reflection. This is the dimension: clarity, organization, relevance, reflective thinking, interconnection, evidence of learning, and this is from superior to unacceptable. So what is your, and this is the comment, what worked well, what improve could be made, and this is the mark for this rubric. What is your opinion about this rubric? Is it okay with you? And why? For superior 3 to 1 and acceptable 0, and the total mark is 18. So can you evaluate this rubric? What is good in it and what is not good? Subjective. Why it is subjective, Dr. Iman?
Which is acceptable for one, it could be not acceptable for the other. What is the criteria to accept this? What is it should be more specific, more
detailed. Rating scale, yes.
More detailed.
So this is just a rating scale. This is not a rubric. You agree with me?
Yes, it is a rating scale, yes.
Yes, thank you, Dr. Ghada and Dr. Iman. Yes. To be a rubric, it needs to be like this. For clarity, what we mean by 3 or acceptable or superior or sufficient or minimal need explanation to be a rubric. So this is just a tool to put the mark, but the trainee or the one who will score the student need to read every cell of this table to know what we mean by organization. That the student is superior. He or she will organized with excellent sentence, paragraph construction. Thoughts are expressed in a coherent and logic manner. So this means 3 in the organization. So thank you, Dr. Ghada and Dr. Iman, that you raised this important point, because this is not a rubric. This is just a rating scale like that we mentioned in the scoring. So in reflection, it must be a rubric. It is not good to have just a rating scale. So this is just an example of a rubric, and this is as suggested by Dr. Ghada. We can upload it to any AI tools and upload the student reflection and ask the tool to write a feedback to the student based on his or her reflection. But we need, as we agree in all AI tools, to review this feedback first, and after, if it is acceptable for you, you can forward it to the student. And now in the era of AI agent, we can develop what is called AI agent that can do this without any human interference. But we need at first to ensure that this AI agent is a good assessor. After this, you can just, the student will upload the reflection, and the AI agent will score it, give feedback, and directly send the feedback to the student, whatever, through his or her email or through the WhatsApp, Telegram, whatever, and this is called AI agent. And because we are now in the era in which is called AI agent and agentic AI, and this is the physiological development of AI from generative AI to customized GPT, and now we are in the AI agent and agentic AI. And we don't know what, inshallah, will be tomorrow in AI. Okay, so this is about reflection, and about reflection is one of the, could be considered as one of the performance assessment that include task. The task is writing reflection, and a tool to score or mark this assessment, which is a rubric as you just see. Okay. From reflection to feedback, we give feedback, and then the student write her or his reflection, and this feedback must be effective or constructive feedback. And to have effective or constructive feedback, it must be objective, and the criteria are clear. Timing, in which time you will give the student the feedback, regular or frequent. Evidence collected is fair, must be evidence. So the form of workplace-based assessment could be considered as evidence for giving feedback. Learner must have input. It is not to be one way from me as an instructor or trainer to the trainee. Balanced sandwich, as we will mention, inshallah, is specific and solution provided. It must follow or accompanied with an action plan for improvement or action plan for remediation. We have many guidelines and tips and approach. One of them is of ND 1983, to be undertaking with a teacher and trainee working as a lead with common goals, be well timed, as we mentioned, be based in first-hand data, regulated in quantity and limited to behavior. We usually said that we critique the behavior, not the person himself or herself. Be phrased in descriptive, non-evaluative or judgmental language. Deal with specific performance, not generalization. It is not like you are, if you say to the student, you are not organized. So we have to mistake here that it is generalized, and also it is emphasized on the person, not the behavior. So you must focus on the behavior, which is remediable, by the way, not in his or her personality, for example, and not to be generalized. Offer subjective data labeled as such. Deal with decision and action rather than assumed intention or interpretation. Just example. We have many models. Start from sandwich techniques, like a sandwich start by the good, then the area need improvement, then again to reinforcing statement, and by the end, action plan for improvement. One of its drawbacks, it is one way. There is no self-assessment in this sandwich, but it is like a sandwich, so it can be like a takeaway. If you didn't have enough time, You can give this model in 1 or 2 minutes. Then we have what is called Pendleton model. Start by the learner who has an action or input and like a reflection. State what went well, teacher reply and ask to what went well, learner again state what can be improved, teacher reply and add. So it is a dialogue between the student and or trainee and the trainer or and his or her teacher. So this is one of the most effective model for giving constructive feedback. We have another one which is a mix between reflective and feedback. It is like a reflective feedback, starting with the learner, concern, and the positive, negative areas, what could be being better, then the facilitator of reflection by teacher and giving correction as needed. So it is like the Pendleton, but it is a short one. It is not a dialogue. Students start by reflection, then the trainer gives his or her feedback. So it is not detailed like Pendleton one. We have also R2C2, 2R and 2C, rapport and relationship, which is important to start by make the student in a safe environment and start by something which is not related to the subject of feedback, like the favorite teams of the student or one of the match that yesterday or today goes about his or her team, for example, to build a rapport between you and the trainee. Then the action exploration, content exploration, coaching for performance. But it is one of the models that is really to be used. We have also peerless partnership like this, empathy, apology, respect, limitation, support. Also, we rarely use it. But the last one we can use it, which is ask, tell, ask. You start the session by asking the learner about self-assessment, then telling the learner area of agreement and additional observation, then asking the learner their understanding and the plan for improvement. So in ask, tell, ask, the student has more input in the feedback. We usually use either feedback sandwich or the Pendleton or the ask, tell, ask model. This is the most common tools or models that be used in for giving feedback. So this is the feedback sandwich. Start by positive, constructive feedback, then positive, and in between the constructive, which is the beef or the cheese or whatever, it is in between two area of positive feedback. And the Pendleton, as we mentioned, that is one of the common models. Ask trainee what they thought was good. Tell. It is like ask, tell, ask, but we have one more tell by the end. Ask trainee what they thought was good. Tell trainee what you thought was good. Ask trainee what they need to change. Tell trainee what they need to change. Simply like this. And this is the modified ask, tell, ask, because we have one more tell. Ask, tell, ask, tell. What is the benefit of it? As we see here, that the learner centered, it is a learner centered feedback. It is active and interactive because both parties participate in the feedback process. Avoid assumption and or judgment, because the student tells the positive and the area of improvement or the corrective area. Reflection also make it easier to separate the behavior from the person, because the reflection, it is by the student or the trainee, him or herself. Promote lifelong self-reflection, as we mentioned, because you can train the student on self-awareness using this model. And also it is has some sort of training on communication skills. To summarize, this is the reflective one, or the reflective approach, which is really to be used, as we mentioned. To summarize, the effective feedback need to be objective, criteria are clear, timing, regular, evidence collected is fair, learner has input, balance, specific, and solution provided, and is the main elements of effective or constructive feedback to be given. Again, objective, timing, regular, evidence, learner has input, balance and specific, and solution provided. Remember those 6 elements of feedback, because inshallah you will watch a video about different setting of feedback, and I need you after each session, it is like a 2-minute session for each, to evaluate or critique the feedback session based on those criteria. And you can add more from your, mashallah, your experience. So let's together watch this series of video. These are 3 short video or mini video, and after each one, I'll ask you to evaluate or critique each one. Okay, let's start. Bismillah. The first scenario.
Hi, Jeremy. Hello, Dr. Lake. Oh, Dr. Lake. I've just finished my term in medicine, and I need to get my assessment form filled out. Is that you? Yeah, sure. Okay. Who are you working with at the moment? Dr. Jones. Right. Okay. Any problems? No, everything's fine. It's good. Sure. Okay, I'll send it in for you. Thank you.
It finished. Okay, كده خلاص. We finished the session of feedback. So what is your opinion about this feedback? Feel free to answer in the chat, or even open the mic and answer.
Good evening, sir.
Sure.
Yes, I would like to start that the place where the conversation is happening and where they wanted to discuss was not right. Firstly,
Okay.
it should be in a separate room. It should be more of formal.
Yes.
And the other thing is, it was not very it was not informative.
Good.
It was not clear as to what has to be, what was discussed.
MashaAllah. Good, Doctora.
Yes, sir. And even the doctor who was giving feedback, she was also not attentive.
Yes, yes. I get fully agree with you. Okay. But
it was for a very, yes, sir.
Continue, Doctor.
And it was not very informative, and she could not give proper feedback also. It was not a proper feedback, neither was it constructive. And such feedback is not going to help the student also. So it is only, it is not a constructive, and was just filling of paper. So it is not useful for the student.
Okay, so it is, I think it is, as mentioned by all the doctors, Dr. Amira, it is not constructive, it is fast. Dr. Wissam, not in appropriate time and location. Dr. Abira rapid. Dr. Marwa very short. Dr. Wissam, as you mentioned, Dr. not informative for the learner. Inattentive, Dr. Hadir. Dr. Marwa on the go. Yes, it is on the go. It is not sandwich. It is not even takeaway. Dr. Iman, not constructive. Dr. Wissam, again, no outcomes except filling the paper. Yes. Dr. Basim, it was non-professional. Wallahi, I fully, mashallah alaikum, I fully agree with you about this. Couldn't be considered as feedback. But before going to the next scenario, but is this a real situation? We are confronted sometimes by situation like this, or it is from we didn't have something like this.
It's real and common, not only real.
Wallahi, yes, I like this transparency, Dr. Ghada, and yes, it is real and common. Yes, it is common. Wallahi, yes, Dr. Wissam, stressful condition and for serious. Wallahi, I agree with you. But we just mentioned what happened, because it okay. Yes, sure. Okay, thank you. The default. Thank you, Dr. Iman. It is common, Dr. Wissam. Okay. بس يعني ما شاء الله يعني transparency is good. So let's go to the second scenario, and I need your feedback about it. Okay.
I'm Jeremy. Hi, Dr. Lake. Dr. Lake, I finished my term in medicine and I need to get my assessment form filled out. Sure. Okay. Look, I'm a bit busy at the moment. Can you hold on to that? And perhaps can you meet me later in the week? Let's say Friday at 8 o'clock in my office. Yeah, we'll do it then. Yeah. Okay. Good. Yep. See you then. Thank you.
Hi, Jeremy. Come in. Sorry, Jeremy. Things have been quite hectic this week. Just a minute. Hello, Fiona Lake. No, not now, thanks. Look, can we make it 10 o'clock on the wards? And we'll be there. Okay, great. Sorry about that. Well, is that for? Yes. Good. Okay. Look, I have a bit of concern about your discharge summaries. Sue on the ward tells me that they're not all being completed, and that's unacceptable. They're very important, and they really must be done. And I think I've mentioned to you before, you've got to keep your case notes up to date. I've come in on the wards to the wards occasionally over weekends, and I can't work out what's going on with patients, and that's very important. But in general, things seem to be fine. All right. So I have to fill out the form. So I'll do this for you and get it sent in. Okay. All right.
Okay. What is your opinion in the second scenario? We need to give constructive feedback that we can start by the good.
It's all negative.
Okay. Who will participate?
The feedback was all negative comments.
Okay. Let's
not the sound. Not the
Natala
sound.
start by anything which is good. Yes, I agree with you, by the way, but there is no good in this time, rather the first one.
The place is better. It's in the office, unlike the first one.
Yes.
And they are sitting face to face.
Good, mashallah. Thank you, Kramen. So it is like the good, and I leave you to say some of the area or of improvement in this feedback, as you mentioned. It is mainly related to the negative things. You mentioned it, yes? Okay, thank you, Dr. Mental. We have also Dr. Somserti, okay, on mobile and the very direct road approach on way feedback. One way feedback is the student or trainee didn't participate. Dr. Sam, one way and harsh. It is informative. Dr. Amira, Dr. Iman, it is professional. Okay, Dr. Shima, it is one way feedback with no reflection. The student or trainee didn't participate. Yes. Dr. Amira, arranging time and respecting the candidate. I agree with you, Dr. Amira, because when he met him on the stairs, he asked him she is busy and will arrange for a time. Setting are better. Yes, Dr. Basim. The student wasn't given a chance to reflect. Yes, Dr. Marwa. It is one way. Okay. But I think it is improved. It improved rather than the first session. But still, if we go to the criteria that we mentioned about the objective, two-way, and the action plan for improvement and the evidence, it missed a lot of element of constructive or effective feedback, as you, mashallah, mentioned. Let's go to the third scenario.
Let me find your form, which is somewhere in my file. Here it is. This is your last week?
Yes, I'm off to cardiology next week.
That should be fun.
Yeah, look forward to it.
Now, overall, we're very pleased with your performance, and I've discussed your appraisal with the other consultants and with the registrar. We're happy about your general knowledge and your clinical skills, and you seem to be coping with most of the problems that occur on the wards. I've talked to Sam and he's happy about your procedural skills, bloods and drips and things like that. And you also seem to be communicating quite well with the patients and the staff around the place. Now, Sue on the ward tells me you're not completing all your discharge summaries, and that is a concern. Do you have any reason why that's happening?
I guess I get busy and they get left to last, the last thing to be done.
Yeah, I can understand that, but you've got to realise that they're absolutely essential. It's the only way we communicate with general practitioners, and so they're very important to do and should in fact have a higher priority over other things. Along the same lines, I have some concerns about that you're not keeping your case notes up to date. Occasionally I've come in on weekends and not all the information is there, and it makes it very difficult for me to know what's happening to the patient. So you've really got to think about that. But overall, we're very happy with the performance. We think we'd rate it as average to above average.
Thanks.
Is there anything that you have concerns about or anything you're leaving this term that you feel uncomfortable about?
I feel I'm not very happy interpreting chest x-rays and ECGs, and they seem to come up with every patient.
Sure, yeah, okay. Look, why don't we meet after Thursday's meeting for an hour or so, and I'll pull out some chest x-rays and ECGs and we can go through them and think about what the problem might be.
That would be really good.
Okay. So you need to sign this now, which I've already completed. You need to have a look through it, make sure you're comfortable, and then sign the back of it. All right, so I'll just give you a few moments to look through that.
Okay, thank you.
Okay. What were good in this the last scenario?
Sir, I would like to start, sir. The doctor, she has started with a positive note and constructive feedback was given.
Yes.
And she has addressed her concerns on where the student was good and where the student was lagging. Then she has given an opportunity for the student to reflect on his performance.
Yes.
And again, a constructive feedback was given.
Mhm.
Later, she has asked for concerns of the students and she has addressed them. And they have commonly come to a conclusion and they have commonly come to an agreement.
Okay.
That is
So
what we have
there is like a
understood, sir.
plan that you will to improve.
Yes, sir.
Okay, thank you, Doctor. And we have here Dr. Abir, more professional. Dr. Amira, informative, respectful, yes. What about you remember in the second scenario, it is like a threatening environment. I think this time it is not threatening environment. It is more friendly than the previous one. And also there is evidence that she mentioned that they said, and there is some evidence about his performance, and this is important also on giving constructive feedback. And I agree with you that it is safe, documented, yes, Dr. Marwa. And it is not a one-way feedback, but it is a two-way. And he has the opportunity to speak and to mention even his concern about the rotation, which I think it is much better. So I usually say that the Dr. Fiona attended with you session like this, so she improved in giving feedback after taking a session on giving constructive feedback. So I think she become much better than before after attending the session with Ismina Fry. Okay, thank you, and I hope this. Thank you, Doctor. Thank you. Okay, I think كده الحمد لله we go through different feedback scenarios with step by step till we have, mashallah, يعني alhamdulillah, the last one. It is we didn't say positive, but it's a constructive feedback, which is a specific, constructive, focus on positive, which is two-way. So I think it is cover all the element of good feedback or constructive feedback, which we mentioned before. The last part of the session, inshallah, for the last maybe 10 minutes is about portfolio, especially the e-portfolio. We need to develop a portfolio not only for workplace-based assessment, but for all the work of our student. And nowadays we have like a 6-year portfolio, which lies a showcase for student performance during his or her program. And we need to start by a plan. What I need to learn? How am I going to learn it? Method, resources, time frame, review, achieve, need to modify. This is like a summary of the portfolio. That its aims must be smart, specific, contains artifact or element which are measurable, could be applicable, relevant, and time bounded. Any portfolio should start by a learning contract, include the objective to be followed, evidence of learning to be mentioned. For example, here in workplace-based assessment, we have the checklist or the rating scales or the form that the student will collect it. Yes, Dr. Salo, it is very important for quality, but we need to differentiate between the course portfolio and the student portfolio, which for the quality, I think you are speaking about the course portfolio, but you are now speaking about the student portfolio. So I hope that I mentioned or I explained we have different categories of portfolio. Okay, and we need to add in it any evidence of learning from learning contract related to the workplace-based assessment, and also the evidence for self-directed learning, and of course the reflection. Okay, let's go. I leave all the, you have already the full presentation. So this is like the learning contract, learning objective, learning resource, target date, evidence accomplishment, and specific measurement criteria. This is to have the student to know. We have like a hard copy portfolio and the e-portfolio. The e-portfolio will contain the evidence of student performance, and usually it present on large learning management system like Blackboard, for example. So it can include image, files, multimedia, blogs, entries, and hyperlink, for example. So it is electronic compilations of academic, personal, professional development, demonstrate skill development, reflection, course achievement. By the end, it can be like a showcasing student best work, or like a CV. It can include text file, image, audio, videos, and even and for again for the workplace-based assessment, it will include the forms for many clinical exam, case-based discussion, logbox, reflective journal, videos, whatever you agree, because it is like an agreement between us and our student. Whatever we agree upon, the student will collect. But we need to leave some flexibility for the student for innovation or for creativity. Sometimes you can ask him this is to be collected as a minimum, but you feel free to add anything that can prove your learning and prove your experience in our rotation or our course. And mashallah, our daughter and sons are innovative. They can have more than we expected from them. But let's agree that portfolio is challenging for us and for the student. So it needs like a plan. So you need to introduce it early in the rotation, that you may have in the orientation like a mini session about the portfolio definition, component, and the weight in assessment. Sometimes, especially if it is in the learning management system or it is an electronic, you need to ensure that they have access to it without any technical problem, and also the guy who are responsible for technical support are there when the student need any support. Also, you need to make it not to be a summative. It should be also a formative, that the student midway in the midterm, they can ask you and take your opinion about the artifacts they already collected in their portfolio. And even you can incorporate peer review for collaboration element and ask a student to review the portfolio for each one, for each other, because it is not summative. So it is no problem that the student can see and watch and even review the portfolio of their colleague. Again, we have some challenge. Trainee don't allow us understand the purpose of creating portfolio. We need to make this in the orientation. Also, sometimes it could be stressful for them, especially if they don't start to collect the artifact or the element of portfolio from the start. So we need again explain the reasoning of it. You need to familiarize yourself with the platform and the student. Create detailed instruction and expectation from the trainee. Scaffolding the portfolio project into several smaller components, as we mentioned, that we can ask the student the reflection. You need to write the reflection day by day or week by week, not to wait to the last week and write the full reflection. This is for example. And for example, if you have some multimedia or presentation, you need to start to prepare it from the early or the poster. And midway, you can come to me and to review it and to take some constructive feedback about it. Also, like the reflection, we have also a rubric for the portfolio. So the student must have this rubric from the start. By the way, they can know the criteria of evaluations that they will be assessed against them. The same, a draft of portfolio can be submitted midway for giving feedback so the student can improve their portfolio. And you can give them some guiding questions for reflection like that we mentioned in reflective journal. Again, it is not like a one size fits all, but we need to be flexible with the student. So for example, if you have a multimedia or something, you can ask them to generate a blog or a personal website, or use PowerPoint presentation, write a reflective journal by the way they want. But by the end, they have a reflection. The way or the method, you can leave them to for creativity. This is an example for the portfolio that we are used to ask our students to use in King Abdulaziz University, which is part of the Blackboard. And I think the model can have something like this. But if you don't have Blackboard or model, you can also use Google Drive, SharePoint, whatever. MashaAllah, we have now a lot of electronic tools that can be used for e-portfolio. And I think if I ask you, more one of you have experience of using electronic portfolio by the way or by the tools that you have, because mashallah we have many tools for it. The last but not least is you need also to have a rubric for marking it. I hope inshallah it will open. Okay, let's go to here. I have more than one, but I don't know where it is. Okay, I think we put okay. This is just an example of rubric for a portfolio. You can add or delete from it what you want based on the requirement. And again, leave some element for student creativity to be included in the portfolio. So this is just example of it. Selection of artifact, which is the element, use of multimedia, reflection, creativity and the purpose of the index, ease of navigation. This is e-portfolio. So you have here ease of navigation because it can be through a blog or website or whatever. And also for each item in it, there is the full description of this item, selection of artifact, use of multimedia, the reflection, or whatever. So this is just an example for the rubric for portfolio evaluation. I think, alhamdulillah, we finished the workplace-based assessment. And on my YouTube channel, you can find maybe 6 or 7 videos that cover everything related to workplace-based assessment, including this session from the start. It is like a mini session, each one maybe 15 or 20 minutes for the workplace-based assessment. I think, inshallah, you can benefit from these videos. And by the way, also you can find videos related to the AI, using AI, maybe 15 or I think maybe now 20 videos for all what is related to using AI, including in assessment, in teaching, in learning, and research. So you can also find many videos related to the use of AI in not only in assessment. So this is I think it is now time if you have any questions, because I think we have maybe 5 minutes. If you have any questions, you are most welcome. And thank you for being okay. I'll send it, Dr. Shaima, just 1 minute to have it, because to finish everything. Okay. Any questions? Control C. And the link of YouTube channel is here. Okay, كده الحمد لله we finished الحمد لله. Any questions, anything you want from me? Okay. See you inshallah, hopefully back in maybe in January. And by the way, the batch which is year 1 in their session, we changed the curriculum of assessment, that we have a mini session of using AI on assessment. So I think if we have some of you from year 1, we already cover AI in assessment, but inshallah we can arrange with Dr. Randa to have another session for using AI in assessment. جزاكم الله كل خير, and see you. Thank you, Ms. Shaima and Ms. Hikmat, for the support, for everything you do, and hopefully, inshallah, you will finish your project and your fellowship, and we continue communication not only through SUB NAFRAI, but by all ways. Thank you. Assalamu alaikum wa rahmatullahi wa barakatuh.
وعليكم السلام ورحمة الله وبركاته دكتور.